Hi everyone, talking a little bit more about surgical treatment options for sesamoiditis. This is really going to be taking place when there's more of a chronic sesamoiditis or sesamoidopathy. There could be a fracture that's occurred there, and really getting a clear idea of, okay, what's occurred and why isn't it healing? And then if we still can't heal it, then we might be looking at one of these surgeries. So what we can do is a partial or complete sesamoidectomy. So depending on whether the sesamoid is in one piece or two pieces, will typically dictate how I go about undertaking this procedure. If it's only half is a concern and I'm finding that it may be more of the distal or more of the proximal aspect, then that's where I'm going to be removing that part. Where I can keep part of it within, that's going to be great, but sometimes I do need to go through and remove the whole sesamoid, and that's going to be okay as well. We just need to be really looking at making sure that, you know, we're getting that patient back onto their feet. One of the other options that we do have available is the dorsal closing base wedge osteotomy. Now what this is that first metatarsal may be very plantarflexed and overloading the sesamoid complex at the plantar distal aspect. And in order to take away some of those forces, we can just slightly move that first metatarsal into a more dorsiflex position, spreading those peak pressures more evenly throughout the forefoot. Now this is a really good option for those that are, you know, happy to undertake a little bit more of a prolonged non-weight bearing period, but really it does give a much better longer term outcome overall because we're not having to remove that sesamoid, particularly in younger patients. For those that are really flat-footed, getting a lot of shear forces, they might have them through the forefoot, that is, and they might have more of a medialized subtalar joint, then that's where we can potentially look at a HyProCure Arthroereisis. And this is a type of stent or implant that goes into the subtalar joint and corrects that subtalar joint axis so that we're moving forward more appropriately. Think about it like an internal orthosis. It may be used in conjunction with one of our other procedures to prevent future concerns, but it can be a good option just to, you know, stop some of that abnormal movement and increase that potential hallux limitus that is occurring through that forefoot and in particular through that first metatarsophalangeal joint. Of course, this is going to be very much dependent on, you know, how your foot's functioning or how the patient's foot functions, and so making sure that we get a really a broad overview and, you know, thorough assessment is you know, really critical for choosing the right procedure for each patient. But for the moment, that's given you a few different surgical treatment options for sesamoiditis. Hopefully that's given you, you know, a bit more information. Please, if you like this video, hit the subscribe button, check out some of the other videos, and we'll see you there. Cheers.